On with coronavirus, and in a moment we're going to speak with Dr. Anthony Fauci about where things stand, those glimmers of hope he's talked about, and how about it, that statement of his that maybe shaking hands should really become a thing of the past. We'll ask him about it just ahead.
All right, but first, why don't we get you caught up on the very latest? Even though there is positive news on the outbreak, the number of cases in the United States has risen above 431,000. The death toll, nearly 15,000. And a troubling outbreak now in the grips of one of our nation's largest jails. More than 350 inmates and staff at Chicago's Cook County Jail have now tested positive. Meantime, U.S. air travel hit a record low amid the pandemic. The TSA says fewer than 100,000 people were screened on Tuesday. That is a 95% drop from 1 year ago and the smallest number in nearly 70 years. We're going to start our coverage with NBC's Gabe Gutierrez, including those new back-to-work essential guidelines for workers. Gabe, good morning.
Hoda, good morning. The world is beginning to see signs that drastic changes in human behavior are slowing the spread of COVID-19, but it has been a simply awful week here in New York, where the virus is taking hundreds of lives every day.
This morning, new signs from the White House Coronavirus Task Force that social distancing, in an effort to flatten the curve, is working.
Our data is telling us that mitigation is working. Keep your foot on the accelerator, because that's what's going to get us through this.
Saying the national death toll may not climb nearly as high as once projected.
That's what will change the mortality going forward.
The news comes as the CDC releases new guidelines for essential workers previously banned from going to work if they have been exposed to someone with the virus.
For individuals that have been within 6 feet of a confirmed case or a suspected case, and so that they can, under certain circumstances, they can go back to work if they're asymptomatic.
And even in the nation's epicenter, there's some encouraging news. Hospitalizations, ICU admissions, and intubations keep leveling off in New York.
We are flattening the curve because we are rigorous about social distancing.
But the news is not all good. The state of New York has more confirmed coronavirus cases than any country in the world, more than 150,000. 779 deaths in just 24 hours.
Psychologically, I just see the virus everywhere, so it's changed my life probably forever.
Essential workers have been devastated. Just a week after images like this frustrated many, subway cars packed due to reduced service, at least 41 transit workers have died and more than 1,500 have tested positive. And there are new hotspots, including Philadelphia, Washington, D.C., Detroit, Chicago, and New Orleans, where the convention center, retrofitted with 1,000 hospital beds, is now taking its first patients. Still, amid the heartbreak, triumph. Nurses and first responders erupting in cheers as this doctor was released from a hospital in New Jersey after spending a month battling COVID-19.
We will get through this. We will fight. We will wake up tomorrow morning again.
Here in New York and across the country, there are fears that warmer weather might lure more people outside. But public health officials cannot say it enough. Now is not the time to stop social distancing. Savannah?
All right, Gabe, thank you very much. And joining us now is Dr. Anthony Fauci, the face of the U.S. response to the virus. He's the longtime director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, good morning. Good to see you again, sir.
Good to be with you.
Over the weekend on one of the Sunday shows, you were very direct. You said, we are still struggling to get this virus under control. Is that still the case this morning?
Yes, it is, I would say, because as you can see, the deaths, the number of deaths and the cases that we're seeing right now are really validating what we said, that this is going to be a very bad week on the one hand. But on the other hand, as you can see, there are some glimmers of hope, particularly when you look at the situation in New York, where the number of hospitalizations, requirements for intensive care and intubation over the last few days have actually stabilized and starting to come down. So even though we're seeing that increase in deaths, as we've seen, unfortunately, like yesterday was the worst day for deaths that we've seen thus far. But what feeds that is the number of new cases, and I believe, and many do, that the mitigation, the physical separation that we've initiated is starting to have a real effect now. So we are hoping, with cautious optimism, that at the same time we're in for a bad week, we're going to start to see a turnaround. So we need to just hope that that happens. I think it will.
Yeah. Is that the flattening of the curve that everybody so famously talks about in New York? Are we seeing the flattening of the curve in this first initial hotspot?
You know, I don't want to jump the gun on that, Savannah, but I think that is the case. You want to see a steady several-day program and profile like that. I think that's what's going on. I'm always very cautious about jumping the gun and saying, well, we have turned the corner. But I think we are really looking at the beginning of that, which would really be very encouraging. We need that right now.
The initial projections, which took a lot of people's breath away, was potentially 100 to 240,000 deaths in this country. Now we have data, not just models, but actual data to plug in and assess. Do you think the number of fatalities in this country will be significantly lower than the 100,000 to 240,000 first projected?
I do, and I believe that the mitigation, I think the American public have done a really terrific job of just buckling down and doing those physical separation and adhering to those guidelines. As I've told you on the show, models are really only as good as the assumptions that you put into the model. But when you start to see real data, you can modify that model. And the real data are telling us that it is highly likely that we're having a definite positive effect by this mitigation things that we're doing, this physical separation. So I believe we are going to see a downturn in that, and it looks more like the 60,000 than the 100 to 200,000. But having said that, we better be careful that we don't say, okay, we're doing so well, we could pull back. We still have to put our foot on the accelerator when it comes to the mitigation and the physical separation.
You weighed in on a theory that's been floating around that perhaps the number of fatalities related to COVID-19 is being inflated because people are actually dying of other things. What's your read on that theory?
You know, Savannah, there is absolutely no evidence that that's the case at all. You know, I think it falls under the category of something that's very unfortunate, these conspiracy theories that we hear about. Every time we have a crisis of any sort, there's always this popping up of conspiracy theories. I think the deaths that we're seeing are coronavirus deaths, and the other deaths are not being counted as coronavirus deaths.
On the flip side of that, do you think there's a potential that we're undercounting coronavirus deaths? Because unfortunately, we've seen it in New York. Some people are dying at home, and there has been a persistent lack of testing.
That's a good point. I think there's more of a chance of missing some that are really coronavirus deaths that are not being counted. But I don't think that number is significant enough to really substantially modify the trends that we're seeing at all.
Okay, let's talk about an antibody test. So I'm not the doctor, you are, but as I understand it, this would be a blood test that would tell people if they've ever had coronavirus. Important because so many people are showing no symptoms at all and may not even know that they have it. How close are we to having that blood test, that antibody test? And are you confident that we'll be able to test massively in a widespread fashion so that people can return to society?
Good questions, Savannah. Yes, the antibody tests are developed. There are several out there. Some are validated to show that they're consistent, and others are in the process of being validated. We are told by the people, the companies that make them, that very soon, when they say soon, they're talking days to weeks, that we'd be able to have a large number of these tests available. And you're right, what they do, they don't tell you whether you are infected, they tell you whether you have been infected. And the answer to that is important because it not only tells you what the penetrance of infection has been in society. There may be many people out there, and I suspect there are a fair amount, that have been infected, were asymptomatic, and didn't know it. You can figure that out because people will have an antibody positivity and yet did not get sick. The other thing that's important is that it is likely, though we need to prove it, that once you've been infected and you have an antibody profile, that you are very likely protected against subsequent challenge to the same virus, which means you may have a cohort of people who are actually protected, who have more of a chance of getting back into the normality of society. And they will be very important. It's very important to know that regarding healthcare workers, because they are the most vulnerable. And if they're protected, they can do their job much better.
Do you envision some scenario in which you attempt to have every American take this antibody test, and on that basis, they're permitted or not permitted to go back into society?
You know, something approaching that, Savannah, I'm not so sure it's every American, but I think when we get to the serosurveillance studies, which would be really flooding the society with the availability of the test, I think something akin to what you're saying is possible.
Let's end on a note. I heard you say in an interview, and you've said a couple times, that we may never really return to the normal life that we once had before coronavirus. But in particular, you said you're not sure we should be shaking hands anymore at all. I like a fist bump as much as the next guy, but are you really suggesting that maybe handshakes should be a thing of the past in our culture?
You know, in a perfect world, when you're dealing with the potential for this terrible ordeal that we're going through right now, knowing that hands and hands to face do it, that would be something that I think would hopefully be attainable, but I don't think it will be. I mean, I said that, you know, somewhat serious and some not realizing that that likely will never happen. What I really wanted to tell people is that when you're talking about getting back to normal, we know now that we can get hit by a catastrophic outbreak like this. The whole world can. We've been talking about this. You know, what's your nightmare that keeps you up at night? A new respiratory infection that is easily transmissible and that has the capability of high morbidity and mortality. And here we are. So that's really what I meant by the world not getting back. Now we know in real time it has happened, and it can happen again. So we really need to be prepared to respond in a much more vigorous way.
Yeah. And I said that was my last question, but really, I'm always reminded of this. All anyone really wants to know from you, Dr. Fauci, is when are things going to get back to normal? Do you think by summer we'll be able to be out and about again?
You know, I hope that that's the case, Savannah, but you know, the virus and how it responds determines the timetable. We can do things to influence that, and I think we're doing a good job. I hope, and I'm cautiously optimistic, that we're going to start seeing that turnaround and that curve not only flattening but coming down. If that occurs, and we have in place the ability to respond appropriately and effectively when the virus wants to start to come back, because it's not going to disappear. It's not going to all of a sudden be eradicated, which means that when we attempt to get back to normal, we have to have in place the ability, when it starts to try and rear its ugly head, we can absolutely suppress it by identification, isolation, contact tracing, the kinds of things we've been speaking about.
Dr. Fauci, it's always good to be with you. Thank you very much. Appreciate it.
Thanks for having me.
7:16. Hoda, nice to have a few glimmers of hope here. Back to you.
Yeah, it was encouraging to hear him. All right, Savannah, thank you. Now to the outbreak's mounting impact on the economy and millions of families in America. New numbers on unemployment claims are coming out this morning, and for the third week in a row, the outlook is historically bad. NBC's Tom Costello has that part of the story. Hey, Tom, good morning.
Yeah, Hoda, good morning. So these numbers are very important because they give us a sense of how long it's going to take, how hard it's going to be to get the economy back up on its feet again. Economists are expecting another 5 million Americans file for unemployment benefits last week, and that would bring the total for the last 3 weeks to 15 million. Those numbers are both record-breaking and heartbreaking because each one of those is somebody who has lost his or her job. Unemployment offices have been overwhelmed with people seeking help. Congress has already approved unemployment benefits for 39 weeks with an additional $600 per week, but the checks have been slow to roll out. Meanwhile, the president is asking Congress for even more money for the new Paycheck Protection Program, which provides loans to small businesses if they agree to keep their employees on staff.
I'm asking Congress to pass additional funding for this program this week as soon as possible. And I think we have a pretty good understanding with the Democrats. Hopefully it's going to be bipartisan.
Republicans and Democrats, though, are divided over how the money will be spent. Democrats want to ensure that at least some of it goes to hospitals, to states, and also to food stamps. One survey finds nearly a third of apartment renters were unable to pay their rent in the first week of this month. And retailers and restaurants have been among the hardest hit, as you know. One poll showing a 59% decline in the restaurant business compared to last year, but you can expect that number will continue to drop even further. Guys, back to you.
All right, Tom, thank you so much. So how about a little good news? Meantime, thousands of grocery shoppers in Atlanta and New Orleans got, an incredible surprise on Wednesday. When it was time to check out, those shoppers found out that all of their groceries had been paid for. The person responsible for this remarkable act of kindness, actor and movie producer Tyler Perry, he picked up the tab during the early morning senior-only hours. That was at Kroger in Atlanta and some Winn-Dixie locations in his hometown of New Orleans. And this all comes just days after Perry gave $21,000 in tips to workers.